The survival outcomes, and remember the primary endpoint of JAVELIN Bladder 100 was really overall survival. And it was positive, and they met the primary endpoint. It was superior in the avelumab arm, which yielded a 21.4 months of overall survival, compared to the best supportive care arm, which is 14.3 months. Now, if you look further in the PDL1 population, subpopulation of patients, it was even better. So the overall survival was actually not yet estimated and not reached versus 17.1 months in the best supportive care arm. Now, in terms of progression-free survival, that was also positive across the board between the overall population, which was about 3.7 months, compared to 2 months only for the best supportive care arm. Whereas in the PDL1 subpopulation, it was also a little better, 5.7 months, compared to the best supportive care arm of 2.1 months. Now, I believe that the endpoints that are really meaningful in this study is overall survival. So this is the one that really resonates, to everybody, to physicians, to patients on board, because overall survival is the key endpoint that we really need to achieve to translate into clinically meaningful survival benefit.
So the survival outcomes tested across various subgroups showed that avelumab was better than best supportive care, regardless of the age, ECOG performance status, first-line chemotherapy, whether it was carboplatin-based or cisplatin-based, and the sites of metastases, and PDL1 status, as well as renal function status. So the hazard ratio favored use of avelumab across the board.
I do think the results of the JAVELIN trial really resonates and hands down is clinically meaningful. Now, if you recall, in terms of upfront chemotherapy use for bladder cancer, there are actually some patients who fall at the end of the curve where we might say that they may have achieved good response, good remission, and maybe cures. That's not everybody, of course, but there is still a subpopulation of patients who are considered great responders, to chemotherapy. So those are also the patients we want to be able to maintain, those good responses. And that's why, a switch maintenance strategy would be clinically meaningful, because we know in the field of bladder cancer, progression sometimes can be rapid in these patients. It's a very aggressive disease. So I think if there is a way for us, and now there is, for not all patients, unfortunately, but a subgroup of patients who may derive a lot of benefit from this maintenance approach with avelumab, I think that would translate into clinically meaningful survival and benefit in terms of quality of life as well.